truly, I believe that most people really don't realize at this point the magnitude of what we have in our hands based on what this company has done. This company that did not start off as the direct marketing companies, they're in the marketing business, and then they go and search for a product to sell, and they subcontract a manufacturer, and now all of a sudden they are in the usual price versus quality war. We are a pharmaceutical Class 1 FDA-approved company, and Greg has been around for 30 years in this type of business. So we're basically a company that develops products for the medical industry. But when these formulations came about, because of the story of our company, then it was obvious the direct marketing channel would be the best possible channel to market this product. I think that Greg has done a tremendous move ahead of coming into direct marketing. He went to the medical community first. In other words, this product was marketed through doctors for the first 2 years because he felt that if we could pass the filter of the medical community, then we can convince any market. It's almost impossible from the medical viewpoint to deny the efficacy and the quality of our product and the technology behind it. Also to find that, you can see results within, let's say, 7 to 12 days on our product. But the doctors that have marketed this product found that if a person stays on this product for 90 days, you have a customer for life. So I view this company as not only a way to make money, but also to have a type of retention rate where you can actually go into compounding accumulation rather than joining companies that have a huge attrition rate where you always have to replace people. And the second layer to this story is that this is a product that will attract a lot of customers. This is not just a marketing excuse. This product will have a tremendous customer attraction, and to kind of fuel that situation, Greg has also engaged Randy Schramm, which is one of the biggest customer acquisition specialists online, because even Gatti Rinker these days uses the internet to acquire customers because the internet is more attendance than television. And at that level, we're eventually going to be capable of acquiring hundreds of thousands of customers in which you can participate through our system, and also into a rep acquisition system that will get better and better as we go along. And having said this, I want to give the call to Greg. I'm excited about hearing how this product really works, what's in it, why is it different than anything else on the market, and a little bit of your story and your passion about what you're doing.
Thanks, Ricardo, and thank you for that introduction. Let me first start off by telling each one of you we appreciate your involvement in this company, and it certainly is our commitment to you to stay way ahead of anything out there in the marketplace in anti-aging and advanced cosmetic products. We started off, as Ricardo mentioned, in biotech business and developing all types of medical products. And it was really an interesting move to find out that one of the products that we had created for chronic wound care, and we were very successful with developing something that would close these terrible high level of chronicity wounds, of non-responding wounds. And to find out that after that product had been approved by the FDA, and years later, that same problem that we had identified in chronic wounds was the issue that really caused aging of the skin, was kind of an interesting revelation for us. Now, we cannot take any credit for finding out that the same protease of high levels were, in fact, the culprit of aging. It was done by an independent study, actually sponsored by the National Institute of Health, who were not concerned with really appearance issues, but they were very concerned with just all the health issues that are surrounded around the skin losing the depth and the collagen in the skin. And, of course, they were not only looking at the face, but they were looking at arms, the feet, why we lose all the padding and the plumpness in the feet, which will cause wounds, and just why the skin becomes so paper thin as we age. And so they identified that, especially between the ages of 20 and 40, that same matrix metalloprotease that we identified in chronic wounds that was elevated, that becomes elevated in the dermis. And as that protease becomes elevated, it starts to degrade the collagen in the dermis. And when that happens, the first evidence of losing that collagen is we start to form lines and wrinkles. And about every 10 years, the study would show that we lose about a tablespoon of collagen in our face alone, just our face, every 10 years. And obviously, the effects of losing that much collagen over time becomes very dramatic. So we knew we had the ingredient that truly downregulates and had proven it both in vivo and in vitro. In other words, both in animals, humans, which we had to, and the FDA. And by the way, with cosmetic, we take a very strong line that we never test anything in animals that is not by law required. And that is, we have a number of commitments as being a green company and also just in how we test products. But Radian's products are never tested ever on animals. The only times that we have had to do that in the biotech company is when by law it's required. And so the product performs beautifully both in a test tube and on humans. And that same product that we had to prove to the FDA to get FDA clearance does the same thing for us in anti-aging. So when that was discovered and we saw that we were successful in a randomized double-blind clinical study for aging of the skin, I started a great deal of discovery and R&D around other elements that are also involved in aging. Lines and wrinkles certainly is the number one reason why we start to appear aged. In the process, there are other factors like sagging skin, like dark spots, sun damage. A lot of people at my age, when we were born, baby boomers, we just simply did not know back then the degree of damage that we would get due to sun damage. And, of course, now there's a much better understanding and there's better products on the market, certainly, to help prevent sun damage. So as a company, our lab's taken a very scientific approach against every element that one would go through that would be the entire arena of aging skin. And tonight I want to highlight 2 or 3 things. Number one, about what makes our product so different because of these active ingredients. And so first I'll just start with, number one, we do have the only down-regulator of proteases on the market. Now, there are products that talk about they inhibit proteases. There's a big difference in down-regulation of proteases and inhibiting. And I want to explain that difference because that is so important for people to understand. And as an illustration of the difference, even in wound care, and I'll go back to the wound care days, if to downregulate the production of proteases at the cellular level would be similar to having a 4-inch pipe bust in your face. And to do what we do in the cellular level, we turn off the production of proteases, meaning like with the pipe illustration, we go in, we fix the pipe, and we stop it from leaking. A inhibitor is a mop that just tries to mop up the problem. And as the water's falling on the floor, they would mop it up and take it out and remove it. And it would be a constant process. Well, in anti-aging, that would give no effect whatsoever. So nothing that would be an inhibitor would help anybody at all in protease technology. But we have the only technology that will actually downregulate production of proteases. Now, what are those proteases doing? They're eating the collagen. Proteases are an enzyme, and they love to destroy both 2 things, peptides, and we have all these natural peptides that are in the skin. Your body is full of peptides that have all kinds of and very important functions both in the skin and the body. And also we have collagen, and the dermis is 90% of the skin, and it's full of this very rich, healthy collagen. And when we're young, there's a perfect balance. But as we start to get older, these protease levels, which are very much at a minor level, they're very much in check as we're younger. But as we start to get older, the actual thing that keeps them in check, called a temp, starts getting out of balance, and then as they become out of balance, they start to destroy both the peptides that are naturally occurring in the skin, and they start to destroy the collagen layers in the skin. Now, so that's the heart of the technology, that when we talk about QXP being in our technology, the Q stands for the downregulation of proteases. The X stands for extracts. In other words, what we do, or we bring these into the formulas in concentrates. And then the P stands for peptides. And for the last few minutes today, I want to talk to you a little about why our peptides, A, are functional, and why they are so useful in our products, and they actually do what they're supposed to do. Peptides are a buzzword for a lot of companies, but when you really look at clinical data with most companies, they're just not able to show you much. And I'm going to explain to you why our peptides are so effective, and why with most companies they seem to not really be able to demonstrate efficacy with peptides. And there are 2 or 3 reasons why. And again, I'm going to go back to the first thing I said. Proteases love to eat peptides, whether the peptides are introduced by a product or whether they're one of the natural peptides that are in the skin automatically. Proteases will destroy them. So if you try to introduce a peptide into the skin and the protease levels are too high, they're going to be destroyed. So that's the problem. And that's why very often people talk about peptides with other products, but again, there's no clinical data that shows that they actually hit the target and are truly functional. Now, a peptide is a protein. They're small chain proteins, and they are sequences that are made of these proteins. And if they were to be damaged, it would be one end or the other end of their chain, and it would be one of the 2 ends that would be damaged. One of the first patents filed years ago was in the combination between our downregulation, which becomes the armor of these peptides. So if you send the peptide into the battle by itself without the armor of something to protect it from the proteases, the odds of that peptide surviving is slim. So the first patent that we filed in this area was in the combination of combining the peptide with the downregulation of the protease. And then the second thing we do is another part of intellectual property that we have is the ability to add an additional sequence to both ends of our peptides that we manufacture that are custom. So anything that we make in our lab, any of these special peptides, we will not only have the sequence that makes it work, but we'll put an extra sequence on both ends. So if they were to get seared on either end, the peptide stays functional. So it can still accomplish what it's meant to accomplish. Now, knowing that, so that this makes our peptide extremely hardy. We don't even have to put as many in to make them very functional. And every one of them, we can do a clinical study and to show that they actually do exactly what we intended for them to do in the body. In other words, they really accomplish the goal of their purpose. I'm going to give you 2 or 3 purposes of the peptide, just so you understand what these active peptides are doing in the product that in combination make these products so unique. Number 1, we have one ingredient that will really cause an absorbency of moisture in the skin. And this is one of the things that really makes you feel the difference of our product. I think you'll really like the texture of the creams, but the texture of the creams in a jar is only one small little aspect. What makes more difference is how does your skin feel after you've used the product a couple days. And one of the things that really makes your skin feel so different after use of the product for a few days is its ability to hold moisture in the skin. We've actually had a lot of customers that say after using the product 3, 4 days, 5 days, they touch their skin, it doesn't feel like their skin. It feels so different. And now, the drier the humidity you live in, the more dramatic that aspect of our product will be. Number 2, in the women's day cream, we have a peptide that will tighten the skin. This really enhances the ability for makeup to look better. You don't have to use as much makeup, and a lot of testing was done to be able to show that it will improve the look of your makeup, and it should, over a short period of time, cause you to be able to reduce like your base and the amount of makeup you have to use. 2 other peptides. We just came out with a new peptide that will be one that you can put directly onto dark spots, that is completely a protein, completely a peptide, no negative effect, but that will take dark spots off the skin. Dark spots happen to be the number 2 reason people look aged over time is for dark spots. It's also in the eye product for taking darkness away from the eye. You'll see a real lightening of these dark spots and the darkness around the eye. One other peptide I'm going to mention today, and this actually came out of our medical research, and very proud of this one. We have a product we just finished in the medical side of our business that will completely remove keloids without any invasive treatment with a topical product with 4 applications. Now, keloids are the types of scars that protrude above the skin level. A lot of people think of them as a rope scar. You've seen people that the scarring will come up above the skin level. Those would be referred to as a keloid. That tissue becomes extremely hard, and we ended up coming up with a medical technology that has 4 separate peptides in it. And one of those peptides softens that very hard tissue, and it will soften that hard tissue in 1 application. What we found is people that have photoaging or sun-damaged skin, it hardens the skin. And we can take that same peptide and we can add a small amount into the product. We've all seen people at the beach, and it looks like their skin will look like a leather handbag. It's very hardened skin. People have different degrees of photoaging of skin, but to be able to cause the skin to be soft is another great benefit to the product line. Always something that is a plus to especially facial products that we're going to apply. So that's another peptide. So those are 4, an illustration of 4 of the peptides, how they function, their active side. Again, every product we have always has QXP, and QXP is what makes this product line so unique. It's the protease downregulators extract with our peptides, and our peptides work because it does have a protease downregulator, and our peptides are so hardy and so functional to be able to make a complete range of things that will deal with every aspect of anti-aging.
If I may ask you to maybe elaborate a little bit on the base of our products. I know our product has a base that is probably 4 or 5 times better than the rest of the industry. And then we have, I understand, all the nutrients, all the antioxidants, all the other things that anyone else does in the industry, only at a higher level. Can you elaborate on that a little bit?
Sure. Great things. And we're so proud of these actives. Being a medical company, that's normally what we talk about, that I think we don't talk about our base enough. A chain is only as strong as its weakest link. We tested our base without our actives very independently to be able to go out to focus groups, for them to say that was the best product they had tested. And how do we do that? Well, our base if you were to have an expert look at our base product, they would say that there are 7 or 8 active products in our base. One thing you'll see right off at the beginning is one of the top ingredients is usually number 2. Now, not always, but usually number 2 would be aloe vera. And we use top-grade aloe vera. The other thing I'll tell you, many of our ingredients are medical-grade ingredients. You can't buy everything in medical grade, but what can be purchased medical grade is. The other thing I will tell you, too, we make every one of our actives in a Class 1 clean rooms in the U.S. All of our products are made in the U.S., so it will remain that way. That all the active ingredients that I just mentioned, peptides and the downregulation of proteases, are made in Class 1, in other words, ethical drug clean rooms. And then The rest of the products are made in the U.S., and anytime we can use medical-grade ingredients, we do. Now, the aloe vera is the top. There are 10 different grades of aloe vera. We use the best that can be purchased. In other words, the most active. We use other things like walnut oil and very, very excellent antioxidants. Again, if you were just to look at our base product, you would see that there are a number of things that other companies would call active and high level of antioxidants. Walnut oil is one of my favorites. It is a tremendous product. Now, I get hit a lot with, why don't you call those actives? Well, we can't do a clinical study on an antioxidant and really show in a given period of time a clinical result. So as a medical mentality, we don't call those actives. With the product for taking away darkness, we can do an independent clinical on that active and show a clinical result. The protease down regulator, we can show an independent clinical. We can on every one of the actives I just talked about tonight. The antioxidants, we all know are fantastic. Aloe vera, people have tried to do clinicals on aloe vera by itself, and even though we all appreciate that it's a tremendous ingredient, those clinical studies did not come out positive in a final result. But we do know it's a great ingredient. So if you look at our base, I think you're going to be able to see that it just reeks a very high-end product. We put more money in our base than the average product out there that would sell much higher. They don't have any of our actives, but our base product is of the highest standard that we can put into a jar.
Sounds wonderful, Greg. I think a lot of people are going to get more excited the more they understand the products. We're also a very customer-oriented type of company. We know that customers are important for two reasons. Number one, because customers make a real business. A business that doesn't attract customers is not a real business. And we see way too many of them online that come and go. The second thing is because now the FTC requires 55% customer volume in any direct marketing company. And we also have a customer acquisition and rep acquisition system that is up and running. As a matter of fact, some of us are already using it, and it's going to be perfect as we go along, but it's extremely functional right now to really be able for us to use that to acquire customers, acquire rep, and help the people that are just beginning in this industry, in this type of business, maybe go a little faster, going a little smoother, rather than living out there all by yourself. So it's wonderful, Greg. I really don't have any other questions for you. Your presentation was
Thanks, Ricardo. Excellent. Greg, amazing information. And thank you, everybody, for joining us tonight.
Thank you, Josh. Appreciate it.
Thank you, Josh, and good night, everyone.
Bye. Good night.
Good night.